Welcome to today's training on how to use a nebulizer. This essential skill will prepare you to assist patients with respiratory conditions by ensuring proper medication delivery. By the end of this presentation, you'll know the components of a nebulizer, how to set it up, and how to instruct patients on its use. A nebulizer is a device that converts liquid medication into a mist, allowing it to be inhaled directly into the lungs. It's commonly used for asthma, COPD, bronchitis, and severe allergies. This method especially benefits patients who struggle to use inhalers or need immediate relief from airway constriction. Nebulizers are typically used in cases such as asthma attacks, delivering quick relief medication to open airways, chronic conditions, for routine management of COPD or cystic fibrosis, severe allergic reactions, providing emergency treatment during airway constriction, infections, administering antibiotics directly to the lungs. Let's go over the main parts of a nebulizer. Compressor unit generates the airflow to create the mist. Medication cup holds the liquid medication. Tubing connects the compressor to the medication cup. Mask or mouthpiece allows the patient to inhale the mist. How to assemble the nebulizer. Once the medication is ready, it's time to assemble the nebulizer. Connect the tubing to the compressor and the medication cup. Attach the mask or mouthpiece to the medication cup. Double-check all connections to ensure they are secure. Preparing the medication. First, let's prepare the nebulizer. Wash your hands to ensure hygiene. Verify the patient's prescription for the correct medication and dosage. Use a sterile dropper to measure the medication and pour it into the medication cup. If needed, add sterile saline solution to dilute the medication. How to administer treatment. Here's how to administer the treatment. Have the patient sit upright in a comfortable chair. Place the mask snugly over their nose and mouth, or have them hold the mouthpiece with their lips sealed tightly around it. Turn on the compressor to begin the mist flow. Instruct the patient to breathe slowly and deeply, holding each breath for 2 to 3 seconds before exhaling. Continue the treatment until the medication cup is empty, usually 5 to 10 minutes. After treatment steps. After the treatment, turn off the compressor and disconnect the tubing. Dispose of any remaining medication from the cup. Rinse the medication cup, mask, and tubing with warm, soapy water and let them air dry. Store the nebulizer in a clean, dry place for future use. Common issues and troubleshooting. Sometimes you might encounter issues. Here's how to troubleshoot. No mist flowing. Check the tubing connections or refill the medication cup. Weak mist. Inspect the compressor filter for clogs. Medication leakage. Ensure the medication cup is sealed tightly.
As medical assistants, you'll often need to teach patients how to use a nebulizer at home. Keep these tips in mind. Use clear, simple language and visuals when explaining the steps. Demonstrate proper assembly and use. Emphasize the importance of cleaning the nebulizer after each use. Encourage patients to ask questions and address any concerns.
Let's review what we've covered today. What a nebulizer is and when it's used. The components of a nebulizer. Step-by-step instructions for assembling and using the device. Troubleshooting and teaching tips for patients. Nebulizers are vital tools in managing respiratory conditions. You can assist patients confidently and effectively with the skills you've learned today. Great job, everyone, and thank you for watching. Please like, comment, and subscribe to the channel for more clinical content.